Good afternoon. How's everybody doing? Good. Excellent. And thank you, Mardrikas, for that kind introduction, and thank you for your leadership and the work that you do day in and day out on this critical and important issue. All of us at the Human Rights Campaign have been so fortunate to have a partner like the Elton John AIDS Foundation to make our HIV 360 Fellowship possible. Mardrikas and all of our fellows are doing truly remarkable work. And they are also led by a number of my colleagues at HRC, some of whom I've seen already, and perhaps most of whom you've already met. But I do want to introduce and thank Marvell Terry II, who's HRC's HIV and AIDS project manager. Where are you, Marvell? There he is. I also want to acknowledge MB Maxwell, our Senior Vice President for Foundation Programs. And then also I see there in the back of the room, Lester Perriman, a member of our National Board of Directors, a great leader and a dear friend. We're going to hear a lot more from him later, but I also want to thank, I don't think he's in the room yet, but I want to thank the Surgeon General for his leadership and for making the time to be here with us today for this critical discussion. And this event would not be possible without so many people and so many great leaders who've worked hard to pull today off. But I particularly want to acknowledge Rafi from the White House, who is a dear friend, has been an incredible champion, and our leader inside the White House, who takes our calls and very patiently works with us as we push to get more done, particularly in these last few weeks of this administration. So we're grateful to Rafi for her leadership. In addition, Nick Martin from Health and Human Services, and also a former colleague of mine at HRC, I'm grateful for Nick's leadership, and Sarah Jane Brady from the Forum for Equality, our colleagues here in the state, as you know. And to our host here at Tulane University, and to Mayor Landrieu and Secretary Gee, and all the public officials here today, thank you for giving this subject the attention it so deserves by marking World AIDS Day here with all of us. Your presence truly speaks volumes to your commitment to these critical issues. 35 years ago, the New York Times published a story deep inside the newspaper, on page A20 actually, about a fatal disease that doctors had recently diagnosed in New York and in California. The headline read, "Rare Cancer Seen in 41 Homosexuals." This rare cancer didn't have a name yet, and those who opened their newspapers and read that article in 1981 had no idea how many lives would be cut short, how many families would be torn apart, and how our world would be rocked by a virus called HIV. But since the earliest days of the AIDS epidemic, what the LGBT community has shown time and time again is an unyielding determination to fight for our lives, to fight for our future, and to fight for the dignity and the respect that every human being deserves. And it's because of that determination and because of that bravery that countless individuals who came before us, brave individuals who came before us, that we have made enormous progress in the fight against HIV and AIDS since those very early days. Today, with proper treatment, a young person diagnosed with HIV can expect to lead a long and healthy life. Scientists and doctors, activists and public officials alike, many of you in this room, have worked tirelessly to reduce the spread of HIV. And because of decades of hard work and determination, an AIDS-free generation is finally within our reach. Working together, advocates and organizations inside and outside government have achieved some significant victories in recent years. From lifting the HIV travel ban and ending outdated policies around HIV-positive organ transplants, to preserving the Ryan White Care Act and passing the Affordable Care Act with life-saving provisions for those living with and affected by HIV, to new prevention tools like PrEP, and advancements in care that allow those living with HIV to become undetectable, stay healthy, and virtually eliminate their chances of transmitting HIV to a partner. But I don't need to tell those of you in this room today that despite all the progress that we've made, the progress that you've helped make possible, who you are and where you live still has an enormous impact on how HIV is likely to impact your life. While it's undeniably true that we've made progress in recent years, it's been far too slow and far too uneven, even in communities, especially in communities most heavily impacted. Right here in the United States, nearly 40,000 people were diagnosed with HIV just last year, and more than 6,000 lost their lives to an otherwise treatable disease. Gay and bisexual men continue to make up more than 60% of new HIV cases in the United States. And if the current trend continues, 1 in 6 gay and bisexual men will contract HIV in their lifetimes. If you're Latino, the rate is 1 in 4. If you're Black, the rate is 1 in 2. That means a young gay or bisexual Black man in America today now has a 60% chance of becoming HIV positive by the time he turns 30. And transgender women are 49 times more likely to be living with HIV. This is unacceptable. It's wrong, and it's on all of us, including our elected leaders, Democrat and Republican alike, to confront this epidemic with the urgency that each and every one of these precious lives deserves. And we must all remember that behind these numbers and behind these statistics are real people, real lives, real families. Many of them are young people of color with full lives ahead of them, and many more live in communities where the stigma associated with being LGBTQ can be overwhelming. And when coupled with the stigma associated with an HIV diagnosis, it can sometimes be too much to bear. That can especially be true in places all across the Deep South. But the good news is that right now we already have the tools we need to stop HIV in its tracks. And no matter who sits in the White House, that reality doesn't change. But what's important, and the real question is, what do we as a nation do with those tools? And that's why the Human Rights Campaign has made this fight one of our top priorities, and let me assure you, we are not about to let up now. We're committed to educating, mobilizing, and advocating for the prevention, treatment, and care that's so crucial to ending this epidemic. First, we're working to ensure that LGBTQ people and our allies truly understand the current realities of HIV by reaching out to our own millions of members and supporters and to millions more through social and through digital media. We're partnering with organizations like the American Medical Association to properly train community advocates and healthcare providers. And we're helping to equip colleges, universities, and community organizations with accurate and LGBTQ affirming resources to aid them in their outreach and their care. Second, we're mobilizing HRC's grassroots army all across the country to take action in support of ending the dual epidemics of HIV and HIV-related stigma. And through our HIV 360s Fellowship Program, we're helping to nurture the next generation of leaders like Mardrikas, to ensure that young people not only have a seat at the table, but a leadership role at the table. HRC is also taking our message directly into communities that need this work the most. At more than 200 Pride festivals nationwide, and especially in some of the hardest hit communities here in the South, we're helping to encourage routine HIV and STI testing, and we're shining a spotlight on instances of HIV-related stigma and discrimination in order to open more minds and to change more hearts. And finally, HRC is committed to upholding the rights and dignity and the well-being of all those living with and affected by HIV. We're doing this by advocating for the funding needed in order to meet the benchmarks outlined in the National HIV and AIDS Strategy, to sustain the Ryan White Care Program, and to accelerate the development of a vaccine and a cure. We continue to lobby Congress to protect our hard-fought gains, including the Affordable Care Act, and to support common sense policies at all levels of our government. We're also supporting community organizing efforts that are so critical to this work, such as the Young Black Gay Men's Policy and Advocacy Summit and the National Transgender Health Conference. This is how together we will conquer the HIV and AIDS epidemic, through education, through outreach, research, and through instilling a real sense of urgency in our fellow Americans. And now, as we all approach a moment of uncertainty for our community and for our country's future, this is no time for complacency. We have all come too far and accomplished too much to allow anyone to take us backwards. And so my message to you here today is this: the LGBTQ community must do in 2017 what we did in 1981. We must organize, we must mobilize, and we must fight harder than we've ever fought before. We must fight because lives are at stake, and so too are the fundamental values of justice and equality. We must fight because every single community, from San Francisco to Indianapolis, Indiana, from New York to New Orleans, we all deserve the resources and the support needed to combat HIV. And I know this is not the place for a political speech, but I do want to be crystal clear about one thing. We must all stand up and fight to expand the Ryan White Care Act, and stand up and fight to defend the Affordable Care Act and the life-saving resources that these laws guarantee for so many in our community and across this country. Because never again can we return to a time when health insurers are allowed to discriminate against anyone by denying or canceling coverage due to HIV status. And never again can we allow the cost of life-saving treatments or preventative measures like PrEP to force someone into having to decide between paying rent or staying healthy. And yes, international AIDS funding is crucial, and it deserves our praise, but more is still desperately needed. And we must not turn a blind eye to the failed proposals here at home, like abstinence-only education, policies that have made matters worse, not better, and policies that have cost our states, our cities, and our country billions of dollars and countless lives. My friends, the fight ahead will not be easy, but the history of our movement shows us that when we all join together, we can achieve what some deemed impossible. Activists, doctors and scientists, philanthropists and elected leaders alike. Since the earliest days of this epidemic, countless individuals have demonstrated that it is within our power. It's within our power to overcome seemingly insurmountable odds. And ultimately, this is about so much more than ending an epidemic. This is about the equal dignity and fundamental worth of each and every person in our country. No matter who you are, where you live, or what you look like, you have the right to lead healthy lives free from fear, free from stigma, and free from discrimination. Those are our inalienable rights. And now, more than ever before, we must fight to preserve, protect, and defend those rights. And so, with gratitude for the pioneers who came before us, and with hope in the young activists here in this room and around the world who are ready to write our next chapter, let us fight on. Let us continue to boldly march forward, and together, let us conquer HIV and AIDS once and for all. Thank you all very much.